to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Pandemic babies are indeed different and not in a good way. The enforced isolation imposed by the COVID-19 pandemic lockdowns may have impeded the social communication skills of babies born during these periods, suggests a research published online in the Archives of Disease in Childhood. Before the advent of coronavirus vaccine, mass lockdowns and mask wearing were deployed to curb the spread of COVID-19 infection, limiting babies' interactions with people outside the home and potentially restricting their access to visual and facial cues for language development. Now, to gauge the potential impact these measures might have had, the researchers assessed 10 parentally reported developmental outcomes for 309 pandemic babies at 12 months of age. The babies were part of the CORAL, or Impact of Coronavirus Pandemic on Allergic and Autoimmune Dysregulation in Infants Born During Lockdown study, and had all been born during the first 3 months of the COVID-19 pandemic in Ireland. Geographical location may cause varying PCOS symptoms in women. Women with polycystic ovary syndrome or PCOS in Alabama may be more likely to have excessive hair growth and insulin resistance, whereas women with PCOS in California may be more likely to have higher testosterone levels, according to new research published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism. Women are diagnosed with PCOS if they have two of the following criteria: androgen excess, ovulatory dysfunction, and polycystic ovaries. The researchers compared data from 1,620 black and white women with PCOS in Alabama and California. They found regional differences in the way these women met criteria for the diagnosis of PCOS and in symptoms associated with PCOS, with some variations among black and white women. Aneurysm rupture risk prediction model developed. Predicting the rupture of aneurysm is crucial for medical prevention and treatment. In physics of fluids, researchers from the Sri Chitra Tirunal Institute for Medical Sciences and Technology, Trivandrum, and the IIT Madras developed a patient-specific mathematical model to examine what aneurysm parameters influence rupture risk prior to surgery. Aneurysms occur when the weakest point of a blood vessel thins, expands, and after a certain limit bursts. In the case of cerebral aneurysms such as internal carotid artery bifurcation aneurysm, blood leaks into the intracranial cavity. Later developmental concerns may be seen in birth weights below the 25th percentile. Being born below the 25th percentile for birth weight may put a child at risk for developmental difficulties, according to a new study by Abiodun Adankin of Coventry University, UK, and colleagues. Babies that are too big or too small are believed to be at risk of poor birth outcomes and problems related to childhood development. But little is known about this relationship across the entire range of birth weights for non-premature babies. To fill this gap, researchers studied the development of more than 6 lakh infants born after 37 weeks of gestation in Scotland. At around 2 or 3 years of age, the children underwent evaluation for social development and for fine motor, gross motor, and communication skills. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.